Hello and welcome back to Ventura County Works, the podcast that connects people, programs, and possibilities across our regional workforce system. Of course, with us today is Rebecca Evans, Executive Director of the Workforce Development Board of Ventura County. Today, we're featuring another episode of Board Member Minute Series, short conversations with the leaders who volunteer their time and insights to help shape workforce development in our county. Our guest today represents the nonprofit community on the board. Their work is rooted in service, equity, and building stronger pathways for people who face barriers to employment. Our guest today is Lisa Safaeinili. Lisa, Rebecca, welcome.
Thank you.
Thank you, Doug. Appreciate that. Good morning, Lisa. It's good to see you.
Good morning. Glad to be here.
Yeah. So we were just talking timely to this episode. Just last week, I attended the nonprofit summit that was hosted by our state assembly members and state senators here locally in the Ventura County region. And your organization, Westminster Free Clinic, received an award as a nonprofit of the year for the state of California. So I just wanted to kick us off with that good news. Do you want to say a little bit about that?
We were so surprised when we were selected because there's so many great nonprofits out there, but we were very grateful and honored. This is our 25th year of the model, the clinic model that we have right now, and so it was kind of cool that it was 2025 that we received this honor. So kind of a very, very meaningful to us, extremely meaningful to us. We're very grateful.
Well, I would say well deserved, and I could definitely tell that those in the room felt the same way. For me, being here in the local area, it's been wonderful to see the Westminster Free Clinic grow in our area and expand geographically to meet some very important needs in our community. I also am interested to hear your journey through nonprofit leadership, as well as the background of Westminster Free Clinic, including the fact that coincidentally you and I worked for one of the same local nonprofits, but at different time periods. I think you were there before me. So, how about sharing with us just a little bit of your background? And don't hold anything back because I think you have a lot to be proud of in terms of what you've spearheaded and what you've led here locally.
Well, I started out, I got my master's in, well, I was undergrad, I was pre-med, thinking I was going to go into medicine, and then realized I was a low-income student myself, putting myself through school, being uninsured myself, and I got into UC Berkeley for a master's in public health, so I was trying to make sure I had some kind of degree to help me put myself through med school, so I became an MPH-RD, registered dietitian, and at Berkeley. And through that process and the internships, I realized I wanted to keep people well and also work in upstream with youth. And so I decided to go that direction. And I went back to Iowa where I had gotten my undergraduate degree and was hired by the university. I taught nonprofit management there, but I was the manager of safety and health for the university and led initiatives in youth development and helping youth make healthy choices and also help them consider going to college, because from the research we had done, it was apparent that the youth were drinking and driving, getting pregnant early because they had no hope for getting out of their little towns and they didn't see a future for themselves. So making unhealthy decisions didn't matter in their eyes. And so that was sort of what triggered the rest of the trajectory of my career path, because from there, when I moved to California, I was looking for where I could help youth and be a leader in youth and health. And I went to a meeting where I was noticed by some board members at many mansions. And so they asked if I'd be interested in working for them and developing a youth development, resource development program and resident services program for many mansions. And that's where I started in the 90s. And then from there, for a while, actually got in 2000, I got a $500,000 grant from the California Wellness Foundation, or California Endowment, actually, at first. And that's where I launched this model that we have right now. It's where we have youth, vulnerable youth from the community who are low income, and giving them a pathway out of poverty. at the same time that we're providing early access to healthcare and filling an immediate need in our community of making sure their parents are well so they can work, they can pay their rent, they can contribute, and to make sure their kids have a safe place to grow up. And so fast forward, then I joined Westminster Free Clinic as their executive director, and I've been working with Westminster Free Clinic for 25 years, and really love it because we engage youth who had never thought that having a healthcare profession would be possible for them, or any profession other than maybe working in the fields or cleaning houses or doing those kinds of, which are great jobs. But these kids are super bright and have a lot of potential. And so now they are dreaming bigger. And after 25 years, we have a lot of graduates now who are physicians and nurses and medical assistants and filling the workforce sector in Ventura County as well as beyond. And as you can see, it's my passion project, certainly to make sure people can stay well, care for their families, and also that youth have a pathway out of poverty and to reach their goals and dreams, whatever they might be, and help the county.
Mm-hmm.
That's my
It is wonderful. It's wonderful to see. And the organization you mentioned, Many Mansions, is a local nonprofit or private affordable housing provider, affordable housing developer, as well as a service provider. And I worked there many years after you were there. However, and I didn't realize at first that you had been there, and then discovered that. And that just really speaks to the small world that we have here in Ventura County, which is wonderful. It helps us be able to connect and really partner and support one another really well. So I want to just say a little bit more about Westminster Free Clinic, and then talk about some other things. But I think what impressed us as a workforce board before you joined the board, we had several conversations with you about the program that you run, because what you have going there really is the essence of workforce development. So do you want to share, could you share just maybe just an example of a pathway of one of the students, like how they start with you and then the steps they go through and what they receive as being a part of, as well as what they give? These students really do contribute, and then their families contribute to Westminster Free Clinic, and then where they go.
I'll give you a local example because this young man is actually working in our county now as a nurse. He started off with us because his mother, who was a patient at our clinic, saw him going in a very negative direction and getting involved with the wrong kids. And she really saw the teens who were helping at our clinic as very focused and hopeful and going in a positive direction. So she really asked us to consider her son for our teen healthcare training and internship program, which is a 2-year program that's year-round. Some kids are there from 9th grade all the way through high school. And so at the time, he didn't give us eye contact. He was kind of, we could tell he probably didn't want to be there. And we decided to give him a chance. And so he joined our program and he would tell you at first he hid in the kitchen. But he slowly saw that, wow, I can make a difference in my community and I can do something with my life. And he started seeing the world in a different way. And by the time he graduated, he had light in his eyes. He was a student manager running the place, and doing very well. Went from not doing well in high school in 9th grade to us providing him, we got him a computer, graphing calculator. He started taking advanced classes so he could be eligible for 4-year college. And he ended up going to Cal State Channel Islands, getting in their nursing program where only 7% are accepted. And not only that, but graduated with honors. And he is now a nurse in our county and still helps us at the clinic. We are his family. We provide, support for him, but he also is always continuing to be so grateful and giving back. And so I'm repeating what he has shared with others already about his journey. And his journey is not unique. There are many, many students just like him who have gone through a clinic and went from being shy or not believing they had possibilities to becoming doctors and licensed clinical social workers and many other kinds of professionals where before they didn't have that hope that they could do that.
That's a wonderful example. And I imagine there are examples all along the career spectrum where there are those that become full-fledged healthcare professionals. There are those, as you said, that become licensed clinical social workers or some related field. There may be those who go through a certificate program and become a paraprofessional or move into some other area of study or occupation. But what we hear from employers, what we hear from our businesses employers is someone with work experience and the experience of the responsibility and the companionship, the partnership that you engage in a workplace is a very valuable asset for a person. And I know that that's what participants also experience and get when they're there at the Westminster Free Clinic. So thank you for that. So, really appreciate that as as an example. So I know we've had many conversations about this, but when we approached you and asked you if you would be interested in joining the workforce board, I wasn't actually sure what your perspective on that would be. So what was appealing to you? What interested you in joining the workforce board?
Well, I love that our missions are aligned. We both are, our goals are to make sure that everyone has a chance to reach their career goals and to be a part of the workforce in Ventura County and develop skills that will help them move up the ladder. And so I thought it was a perfect board for me to say yes to because we do similar work.
Mhm. So what workforce challenges are top of mind for you right now?
I think the biggest one is that healthcare training or is affordable and accessible for all. And that's my biggest worry. I see we have 300 high school students. We have over 50 college students who are on the pathway already, waiting to get into school or going to nursing school or waiting to get into physical therapy school or pharmacy school. And I think they're all eager, they're all hardworking, they're all doing their part, they're volunteering and helping their community. And I see the biggest barrier being affordability.
Mm,
Affordability to complete their education or get into their education. So that would be my biggest concern right now is that there are scholarships, there are financial aid, there are ways to still help everybody who works hard and is smart and capable to be able to reach their goals.
Yes, and I know that's a concern among those in our education partners here locally. You know, you and we work very closely with all levels of education, K through 12, with community colleges, adult ed, the universities that are here locally, and we're so fortunate to have a lot of education opportunities here and in California, and a lot of them nearby. But yes, the ability to afford that education, even when working and trying to go to school, it's quite expensive, even here locally. And so when you have very talented people wanting to move forward and really wanting to be in these high demand jobs, I mean, our healthcare employers will tell you these jobs are definitely in demand and they struggle to fill them, and they would love to fill them with local uh,
Mhm.
individuals, you know, people who are already living here. So that is something I think we all have our eye on that challenge as well. Since joining the workforce board, has there been a moment or a project or anything we've done together that stood out for you?
Well, I really love the workforce board because I think there's a lot of innovation and real passion for helping the community in the workforce sector, you know, meeting the needs of our local county and finding ways to do it. And I think what I see is there's out of the box thinking and, you know, really innovative ideas to try to reach the people who need what the Workforce Development Board has to offer and also to support everyone in our community, the vulnerable populations, everyone having a chance. That's what I love about the workforce board.
Okay, wonderful. Well, and we're certainly very happy to have you as a part of the board. Um, the perspective you bring, the healthcare knowledge you bring, connections, and your experience and knowledge here in the community. So as we start to get close to wrapping up these board member minutes, we do a rapid round of questions. So are you ready?
Yes.
Okay. One word to describe Ventura County's workforce.
Hardworking.
Hardworking, I would agree. A skill everyone should build.
Resilience.
Excellent. Yes, that's going to take you far wherever you're working.
Right, yeah.
Is there a book, podcast, or some other type of media that you'd recommend to anyone in community leadership?
Well, I really like the book Dare to Lead by Brene Brown. There's so
Yeah.
many other books, but that's a
Mhm.
good one.
Yes, and she brings a lot of things from other books into that book as
Yes.
well as her insights. I like that one as well. And it talks about leading from your heart and the
Yes.
vulnerability that comes with that, which is good.
Important. Yeah.
You may have answered this one earlier. If you weren't working in the nonprofit sector, what would you be doing?
Oh, well, I used to teach at a university in nonprofit management and healthcare. I would go back to doing that or working at a foundation, helping other nonprofits get funded and helping in that process. Those would be two things I would do probably.
Yeah, I think you'd excel in that, but I don't think anyone wants to see you make a change anytime soon.
Thank you.
Is there anything, Lisa, that gives you hope about the future of work?
Yes. So I have 300 high school students in a year that I get to see, and college students, as I mentioned earlier. And they are enthusiastic. They love giving back to their community. They come, even though they aren't getting community service hours, they just come because they want to be there and help.
Yeah.
And so they're not coming for a class, they're just coming. And I just see them hopeful for their future. And I think that gives me hope that this next generation really cares. And there's a lot of great kids out there who really want to do something with their life. We just need to give them the opportunity.
Okay.
That's
That is, and when you started with talking about how many you get to see go through the program, it's wonderful. And like as we've talked about before, this really is the essence of workforce development here locally, and we're so happy that the program exists. It's a win, 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 win all the way around for the patients of the clinic, for the families, for the participants, and for us as a community. So thank you so much for sharing your perspective on that. So as we wrap up, I'm going to turn it back over to Doug, but also I want to say, if you're listening to this podcast, if you have any interest in also watching the video on YouTube, this is probably an episode filled with the most smiles. So if you want to see us talk about a little bit of good news and a really great program happening here locally. Thank you.
Thank you.
Doug, I'll turn it back over to you.
Well, thank you so much. And really, that's what I was going to say as well. I really encourage people to actually see this because I feel like it's so nice to have this hopeful conversation. Again, I want to reiterate, I love the board member minutes so that our listeners can get to know the board members and see the hard work, see the people behind all the hard work that makes all of this happen. So, Lisa, I want to thank you for coming on. I want to thank both of you for a positive, hopeful conversation, which I feel like we need more than ever in these times. Thank you so much.
Thank you. Thank you very much for this opportunity.